Senator Cortez Masto is next, and then Senator Young, and we will wrap up one of the best hearings I've certainly been to. Senator Cortez Masto.
Mr. Chairman, I agree. I just have to thank the witnesses for being here. It has been a long morning, but a fruitful discussion. I cannot thank Mr. Chairman, the ranking member of the committee, so much for having this hearing. You know, let me just say, I hear every day from Nevadans that one of the most critical ways we can protect kids' mental health is by keeping our schools open. And that's one of the reasons why I've been working to make sure that our schools stay open, have what they need to keep and help our kids in the classroom and provide important services and support that we're talking about today. One of the areas I'm going to start, Ms. Lubarsky, with you, though, is stigma. My goal has been to tear down that barrier and do away with stigma. Listen, I think that anybody who goes and talks to a doctor about their physical health and has a funding source for that, that should be on par with mental health. That it should be the same thing. You can walk in, get help for your mental health, and it should be funded, and there should be no stigma associated with that. But Ms. Lubarsky, let me ask you, can you talk about the impact that telehealth has had there? Have you seen patients more inclined to follow through on the course of treatment through telehealth? And does that knock down some of that stigma associated with receiving services for mental health?
Absolutely, Senator. Thank you for your question. And when I hear your question, it makes me think of a young lady I worked with years ago. And at the conclusion in every one of our sessions, regardless of the weather, she'd pull over a hooded sweatshirt, sunglasses, and a hat and say, "I don't want anybody to see me walking out of this building with the giant sign that said Mental Health Center out front." So for a youth like her, having that option to sit in the comfort of her home behind a screen and nobody knowing that she was accessing care with me, I think was a complete game changer for many of the youth in our world. So yes, I think the addition of telehealth not only knocked down barriers to getting care, but eliminating the stigma that many youth and families see around mental health care.
Thank you. And one of the things that everybody's been talking about, I so agree, is access to the resources, the funding to support your services when you seek those for mental health. That's one of the reasons why I've partnered with Senator Daines on legislation that actually enables families with high deductible health plans to access no-cost telehealth services before they meet their deductible. What I find is that's often a barrier as well, is just accessing the payment plans, resources to pay for these services. So thank you. Let me ask you this, Mr. Terrell, because I saw you nodding your head. Based on your work with Youthline, can you talk a little bit about the value that peer-to-peer relationships have as well in helping kids feel less isolated and more willing to seek services for their mental health?
Absolutely. Thank you, Senator. I think that's a really great question because part of the reason that Youthline works so well is that it is peer-to-peer. And we know from statistics that youth are more likely to turn to their friends than anyone else. So when we foster that natural partnership, right, it really helps to destigmatize mental health in that regard. But I also think Youthline works so well because it's a crisis support service. And there's a difference in that, right? So a lot of time when we talk about mental health, there's this conception that you only have to be suicidal or experiencing kind of acute high stress situations, when that's not true, right? We know that mental health encompasses a lot of things. And so when we talk about support, Youthline is one of the only crisis lines in the country that offers teens the ability to talk about their mental health struggles without the fear of being like the problem being too small or too big. We really emphasize that there is no problem that is too big or too small. And when we talk about mental health, we really need to recognize that. And just something that my supervisor always says is that we teach young people to call 911 when they're in like emergency settings. And unfortunately, that permeates over to how we like the National Suicide Prevention Line and like 988. So the sooner we can teach children that it's okay to call a crisis line, that it's okay to reach out for support for mental health, I think the more better we'll see this issue become in the future.
And thank you. And I couldn't agree more. I just so appreciate the comments today on the need for more robust crisis services for kids. The chairman and I have worked on this. I truly believe that when we are in crisis mode or they are in crisis mode, there should be a place they call. And it's not law enforcement always responding. It's a mobile crisis intervention unit. That's why the chairman knows this is the CAHOOTS bill that he and I worked on together is based on the best practices in Oregon and his state. And I think there, really the focus for me has been addressing that crisis mode and bringing those essential services at that time. Senator Cornyn and I have introduced legislation that would actually set flexible standards for crisis services and, again, provide insurance coverage, which we see is lacking as well. So I know my time is up. I cannot thank you so much for this conversation. Mr. Chairman, I'm hoping that with telehealth services and so many other areas that we have to focus on, we are actually going to implement more work around bringing essential mental health services to so many in our communities. Thank you again, everyone.